Intermountain Medical Center cares for critically ill patients every day, and treating the patients and their families with care takes extra consideration. Here to explain how staff work to make the experience better for patients and their families is Dr. Samuel Brown. He's the director of Intermountain Medical Center's Center for Humanizing Critical Care. Thanks for joining us today.
Thanks, Nadia. It's a privilege.
When you hear humanizing that experience, this is very unnatural to be in an intensive care unit with some of the injuries that people come in with. What do you usually see people for? What are some of those common reasons why you're interacting with these patients?
Intensive care units are places where we can run life support systems.
Okay.
Before 1960, everybody died of the diseases that are treated in the intensive care unit now. But we developed these marvelous life support systems. So, to get into an intensive care unit, you have to have a disease that's likely to kill you without life support. So that can be serious car accident, that can be an overwhelming infection, that flesh-eating bacteria that everybody's scared of, we would treat those people there.
Yeah.
Terrible lung failure would come to us. Certain kinds of very complicated surgical problems would come to us.
So, I mean, these are very serious conditions that people are dealing with. What kind of toll does that take on the patient and on their families watching their loved one go through all of this?
It's devastating, and it doesn't need to be as devastating as it is. But the statistics are clear. About half of patients get PTSD as a result of being that sick and being in the ICU.
So they're there for you to save their lives, but when they leave, they're most likely going to have post-traumatic stress disorder because of everything that happened to them in that unit.
How sick they were and how uncomfortable a lot of the life support treatments have been in the past.
My goodness. Explain to me, when somebody comes into the unit, that patient, how are they positioned? What are they going through in order for you guys to keep them alive?
So old school was to have them drugged up, tied to a bed, breathing tube down their mouth, through the voice box into the lungs, catheters in their private parts, catheters in their necks, and they're basically like a wax figure in a museum on a bed. And that's the old mechanism. And you can imagine that waking up after that, you're going to have weird fake dreams and nightmares and PTSD. We're working to change that, but that's what we're starting with, is people tied to beds, full of tubes, half conscious on medications. What
are you guys doing to humanize that care, to make it so that we have a drop in that 50% of patients who have PTSD? What's the plan there?
So one thing that we've been doing, and this has been pioneered even before I came to Intermountain, is we're getting them out of bed. It turns out that for a lot of them, being tied to a bed is not a good thing. So we have people walking the halls of the medical center on life support systems, which 20 years ago people would have thought we were smoking marijuana to think that's possible.
You're just nuts for doing that.
No, but Intermountain has been visionary in this department. We've added recently, as the technology's gotten better, there are electronic tablets, computer tablets, that they can watch with their eyes and choose what it is they're trying to say. We've developed menus to allow them to communicate.
And that's someone who's paralyzed or maybe can't use their hands or can't speak at the time.
Correct. The lung life support goes through a breathing tube that's through your voice box. You can't talk around that.
You can't talk. Oh.
It's so hard to not be able to talk.
You're at the forefront of doing something that 50 years ago, as you mentioned, people weren't doing. What do you see in the future? What's your ultimate hope for care?
So what we're hoping for is that people will come through alive, strong, and at peace with the process, having not so much of this post-traumatic stress, anxiety, mental impairment. So we're working across the range. How do you treat people better? How do you communicate with them better? How do you identify specific needs that an individual has? How do you get them doing their physical therapy before they're even better from their original illness?
A lot to tackle. You guys are on top of it at Intermountain Medical Center. Dr. Brown, thanks for coming on the show today.
Thank you. It's a privilege.
And we'll be right